everyone, welcome to another episode of Ask 360, where we're answering all your questions related to health, fitness, rehabilitation and nutrition. Today's question comes from Ivan, and Ivan asks, what is a slip disc and how is it relevant to back pain? So the medical fraternity have really only been studying in detail the anatomy of the intervertebral disc and its relevance to back pain since the 1930s. So this whole field of study is still relatively young. We refer to the intervertebral disc as such because it is disc-like in nature. It is relatively wide in relation to its height and it's circular in shape. However, we tend to conceptualize the disc as more of an intervertebral joint. So just like any other joint in the body, the shoulder joint, knee joint, ankle joint, the intervertebral joint complex consists of two bones, the two vertebral bodies, cartilage that lines those bodies, and soft tissue in between. Annulus fibrosus, which is the outer part of the disc, and the nucleus pulposus, which is the center aspect of the disc. However, the way that these two aspects of the disc complex have been represented, both in textbooks and also in lay media, is somewhat misleading. They often represent the nucleus pulposus as being a very fluid, very soft part, and there's been some horrible models like a jam donut with the hole in the center, things like that, which aren't really helpful in terms of our understanding. We know now that the nucleus pulposus is more viscous in nature, and there's not a clear definition between the nucleus and the annulus. It's more that these structures are layered, and there's different layers to each of those. So the disc is very firmly attached to the bodies, and it can't slip. It can't go anywhere. The term slip disc originates from the earlier researchers and medical professionals' efforts to explain some of the changes that can happen to a disc over time. So just like any other joint, if there's certain amounts of pressure put on the disc over time, or sometimes with excessive force or rapidly applied force, we can get changes to the makeup of the disc. And some of these changes, which people will have perhaps heard of, things like disc bulging, where either the front of the disc, front or the back of the disc, more commonly the back, starts to increase in its circumference. We can get a protrusion where there's a more focal area of that increase. We can get a herniation, which, just like any other hernia in the body, is where some of the disc material starts to push out from within the annulus. You get a tear in the annulus, that outside part of the disc. And then we can also get a sequestration, where we actually get some of that disc fluid that detaches from the disc and sort of is lodged in the spinal canal. Now, while these do sound quite drastic, a lot of the time they are normal findings that happen with age. So disc herniation, for example, if you take your age and add 10, that's a percentage of people your age without back pain. Now we're talking backs here. Obviously, disc changes can happen in the neck and in the mid-back, but when it comes to the lower back, say if we take me as a 23-year-old, we add 10 years, 33% of people my age that don't have back pain, so we're talking about asymptomatic individuals here, will have some findings of a disc herniation if we take a scan such as an MRI of their spine. So we have a very strong understanding there that these changes to the disc aren't necessarily related to pain. Now, we can still have disc-related pain. So just like most of the other structures in the body, the disc has a nerve supply. So if we apply a load or force to that disc, either acutely in a excessive amount of force, a strain, an unaccustomed movement, or we're performing a repetitive movement that our bodies aren't used to, we can cause some stress to that structure, to the disc. We can perhaps cause an inflammatory response around there, and we get an increase in the alarm signals from that area, and in some instances this can cause pain. The trouble then is that often people with back pain are sent for imaging, and we see these scans that show findings of disc changes. However, we know that a lot of the time these disc changes aren't really related to pain. So it's not necessary for disc changes to resolve in order for us to have a positive response to treatment. So if we have a sensible approach to load management, relative rest, but the key word is relative, not over resting an area, a properly designed exercise program, which may include general exercise to try and desensitize the body and address some sort of holistic aspects that may be contributing to back pain, and then some specific exercise targeted at desensitizing that area, or perhaps strengthening and adding capacity to that area, as well as some education and perhaps some manual therapy. Most people will have a positive outcome. If you have been diagnosed as having either changes to the disc, in terms of the changes that we discussed earlier, or if you've been consulting with Dr. Google and the symptoms sound like something that is related to disc pain, then make sure that you do go and see an experienced health practitioner and someone that really understands the current direction and evidence behind back pain management, so that they can explain the relevance of these findings to you and guide you on the most appropriate treatment plan. The important thing is not to fear disc pain, disc pathology, or disc changes. The disc is just another part of the body. It's just another joint. And in general, discs love movement. Movement is medicine. They just need the right type and the right dosage of this medicine at the right time. So thank you again, Ivan. I hope that answers your question. Remember, if you do have any questions, please send them in, and you can go in the running for a free massage. Thanks again, and we'll see you on the next episode.